Hi, and welcome to another edition of our podcast, The Financial Advocates. This is Colin Meeks, your host. Today, we've got a great episode, and you might be wondering, if you're watching this on video, why are there two financial advisors from Baltimore? Why did they drive all the way down to the National Institute of Health to interview somebody who has nothing to do with financial planning and really not our typical guest, but I think you'll be very impressed with what we're about to bring you today. I'm here with Dr. Susan Daniels, who works as the director of the Office of Autism Research Coordination. And rather than read through her whole biography, because it is very impressive, I will just tell you that her entire career has been devoted to helping research topics like autism, neurological disorders, and they put out great content, and I think it will really help our families just by listening to the questions she answers today and also downloading the content that we're going to make available. So welcome to our podcast, Dr. Daniels.
Thank you so much.
Let's just start off. So tell me a little bit about your job here and what you do on a daily basis, and how what your goals are to help people.
Sure. So I run the Interagency Autism Coordinating Committee, which is a federal advisory body that was put together by Congress, most recently in the Autism Cares Act. And this committee's role is to provide a forum for the public to actually interact with the government.
Okay.
And to be able to tell the government their concerns and what they want to see happen, and also to hear what the government is doing. Before the committee was in place, there was no formal channel for doing this, and so the government had its activities and programs and people could find out about them, but now with this committee in place, we have meetings throughout the year where people from the public can come and give oral comments, and they can listen to government agencies talk about their programs and talk with advocates. And so everyone gets together and is able to share that information back and forth, and it really helps the government to be more informed of the issues that are most pressing.
Okay. And you guys do, you more than just the high-level research that we're used to seeing and with children with autism and adults with autism, and you guys are really drilling down each and every year and trying to find breakthroughs and different things that you're trying to bring to the attention of Congress so that it's dealt with in a manner that's good for everybody.
Yes, so in my hat as an employee of the National Institutes of Health, the National Institutes of Health is the leading federal agency for biomedical research, and it does research on autism and many different aspects, including screening, diagnosis, treatments, and understanding the basis of autism, what causes it, what the symptoms are, and how to address issues related to autism. Also, some research on services related to autism and how they can help people.
Yeah, and before we started recording, we were actually privileged enough to sit down with your entire staff. It was awesome because just seeing all the faces and folks that are helping you do what you do is really neat for us to see. But the statistic that I was asking about was was it 58, right?
Yes.
1 in 58 children are diagnosed with autism. So
right.
It's staggering, and to know that out of every 58 people, there's one of them is going to be affected by it. This research is there to help them.
Yes. So the research, the CDC does the prevalence research, and they continue to give us an estimate of prevalence of
right.
autism in the population in the U.S.
Okay, and that's just what's diagnosed. I mean, that's not even the folks that don't know what they don't know.
Right, exactly.
Right. So let's take a look. Last year, you guys put out a report, and the article selected for the 2017 Summary of Advances.
Mm-hmm.
I'd like to just sort of hit on these because and we're going to post this to the show notes, so anybody listening to this can go on and download this report. First of all, it's written very well. You were explaining to me how it's written and who it's written for, so let's talk about that a little bit.
Sure. So the Summary of Advances is a document that our office puts out on behalf of the Interagency Autism Coordinating Committee to help inform Congress and the public of certain advances that have been made in the previous year. And so the committee goes through the research literature of the previous year and selects what they think are the top 20 advances. But they also, in the process of nominating articles that they think are worthy, we also list all of their nominations in the back of the volume, and each of the 20 selected articles is written up in a lay-friendly format, so anyone, a person on the autism spectrum, a family member, a member of Congress, a member of the general public can understand exactly what this research is and what it's accomplishing.
Okay, and that's important because a lot of times we'll pick things up, like I've read a lot of books on this, and like you need some sort of higher degree to understand what research is being done and the output and everything. So this is very good. It's a 40-page summary, and I found it very very interesting to read. But you laid out a handful of questions here. The first one: how can I recognize the signs of autism spectrum disorder, and why is early detection so important? I mean, that's kind of basic, but then you guys really drill down into that. So what sort of things are you finding in that area?
So with these questions, like that question you mentioned, there are 7 questions, and those are actually the framework of our strategic plan. And when they first came up with the strategic plan, the committee was charged with this by Congress to have a strategic plan, and the first one was put out in 2009. They developed this framework of questions. Actually, it was first 6, and now it's 7.
Okay.
And they were just recently revised last year a little bit, but pretty much the same. They cover the areas of screening and diagnosis, the underlying biology of autism, treatments for autism, services, the full lifespan, including all the way into adulthood and aging, and infrastructure that supports research and services for autism. So those were the key areas, and each one is represented by a key question that the community would have about what they need to know about these areas to understand that. So the committee strives to, each year in its publications, answer some of those questions. Right,
and you're drilling down under each one of those questions each year, trying to dig deeper and deeper and find more and more helpful information.
Yes.
What things have you, like in the past year, say, what sort of breakthroughs have been made? I mean, what sort of things could a parent, maybe that they didn't know a year ago, would know now?
So there are a number of things that we have, medical researchers and services researchers have been able to put together to help us understand more about what causes autism, what the early signs are, ways to detect it, treatments, what works, and services that can help serve the community. One of the areas of research right now that we have highlighted in one of our meetings of the IACC, and we will continue to highlight this area, is a better understanding of autism in girls and women, and understanding that it's actually different. And so there are studies on the neurobiology of this, on the behaviors that are associated with it, and what types of treatments or interventions might be most helpful for girls that maybe still need to be developed. So
so you're saying that then for girls and women, the treatment could be different than
it could, maybe not as a block, as we all, and anyone who's involved in the autism community knows that autism manifests differently in each individual, and a different combination of characteristics and challenges that go with each person. And so we know some of the general issues that affect people, but each person is affected differently. But in general, for girls and women, there are some challenges that tend to occur more in them, and that we could potentially develop better interventions that will address those.
Yeah, because I know the statistics, it seems to be more prevalent in boys, or more known in boys, but obviously it affects the whole population. So that's really good stuff that you guys are sort of drilling down and finding those different niches. So let's talk a little bit about transition, because autism isn't something that you outgrow. It's not something that you take a pill for and it goes away.
Right.
As a parent of a child with autism, it's something that I know I'll be dealing with my whole life. We're always worried about what happens when the bus stops coming. Because as somebody turns into adulthood, what sort of things are you guys doing to help that segment of the population?
So there is also research in some of the federal agencies on educational approaches, the transition to higher education, the transition to employment, and what happens to people in employment and adulthood, all of the different services and supports that are needed for people to have a high quality of life throughout the lifespan. There's also needed research on aging and the effects of aging on the autistic population, a number of different challenges that affect them. And with our committee, one of the areas that we're currently focusing on is the health needs of people on the autism spectrum, all the way through the lifespan, including how best for them to get appropriate attention from a medical provider, as many adult medical providers aren't that familiar with autism. So what can we do to help the medical provider community be more familiar with autism and how to best help patients who are affected by autism, but also have very ordinary medical issues that need to be addressed. Yeah,
and that's not, that's more social than medical. It's, how do you recognize, or how do you communicate with somebody with autism that, maybe an older doctor or a doctor that's just used to dealing with older people's, not used to dealing with somebody that can't tell them exactly what's wrong and why it's wrong.
Exactly, and ensuring that people have the supports they need to be able to be compliant with whatever interventions and treatments that they need.
Yeah.
So there may be some unique best practices that need to be developed to help ensure that people get the best help that they can get.
Yeah. Yeah, I mean, this is good stuff because, and then the fact that you're dealing directly with, your stuff goes directly to Congress, and it's hopefully the government is listening and hearing this stuff, and what they do with it hopefully translates into good stuff for our community.
Definitely, and so one of the ways that the committee works is half of the committee is made up of officials from all the federal agencies that work on autism, and the other half is made up of stakeholders from the community, including adults on the autism spectrum, family members, advocates, providers, clinicians, researchers, and so we have a variety of people at the table, but the federal agencies are all represented there.
Right.
And so they have an opportunity to hear firsthand from people in the public what is concerning them and what the major issues are, and then they can take that information back to help them as they shape their programs.
That's amazing. I mean, this is like as a parent and as a professional and as somebody that's very interested in this, it's the amount of information out there is overwhelming, and to try to find out which where that information is and what's going to be the most helpful to anybody is very useful. So having a podcast like this and talking to somebody like you is definitely helping people out there. What kind of information, so we're going to post a lot of this to the show notes, but you guys handed us a stack of publications.
Mm-hmm.
What do you guys put out on a periodic basis, and how do people get that, and how can it help them?
Sure. So Congress charges the committee, as I mentioned, with producing a strategic plan and annually updating it. And so we put out a big revision of the strategic plan last year.
Okay.
And so that's available right now on our website. And we also do have hard copies if somebody wants to write to us. When you go to our website, there's a place where you can submit comments. And if someone wants a hard copy, you can order one for free.
Because one of those might kill an inkjet printer if they try to print.
Yes, it probably would. It's nice online. The PDF is pretty accessible, but for some people they prefer paper,
right.
And so we do have those as well. But that publication describes the key objectives the committee was able to boil down from public comments and consultation with experts on what are the cutting edge opportunities in autism and what are the greatest needs. And so they boiled that down to 23 objectives for the next 5 years for the government and partners in the private sector to work toward accomplishing. And of course these are all these are large goals,
right.
And in 5 years they won't be completed by any means because they're very lofty goals, but they're things that we need to work toward, and periodically the committee updates these with information from the latest research, from the latest issues that are affecting people in the community, and policy changes that also affect people. So that is one document. The Summary of Advances, which you already highlighted, is another document we put out every year on behalf of the committee. And then there's another document called the IACC Autism Research Portfolio Analysis Report that we put out each year, that is a report that captures research that is being conducted across the entire United States. We collect information from all federal agencies as well as the major private funders of autism research, and categorize it according to these 7 questions in the strategic plan, and give a summary of where that research is going and how well we are doing in terms of achieving some of these objectives. And so we try to do that every year, collect the information, and we create a database for that as well, and it's on our website. So if anyone is looking to find out what research projects are being conducted on a topic, say sensory processing in autism, you can put the keyword sensory into our database and you'll be able to pull up all the projects that are related to that. Okay.
And the website, could you hit that? We'll post it to the show notes.
Yes.
What is that?
It is www.iaacc.hhs.gov.
Okay. So if you didn't get that, if you're driving along, we'll definitely post that to the
Sure.
website. So 1 in 58 is diagnosed with autism. It cuts across every economic, racial. There's no specific race. There's no. I mean, it just is. So this information is helpful to anybody and everybody. It's not just inner city, suburbs, rural. This is just all great stuff. So advances that you're seeing, maybe what's on the horizon for you guys in the next 12 months? I mean, I've got this great 2017 summary of advances that is really a good research or a reference tool, but what do you guys have coming down the pike that people can sort of get excited about?
Well, research is always on a kind of long horizon because it takes time from the time people understand that there's a need to developing research projects around these and then seeing the results of those. But some of the areas, like I mentioned, autism in girls and women is one that is kind of newer that is being researched now that we hope in a few years there will be a lot more known about it. There's always information coming out about the underlying biology of autism. There's research on, for example, suicide in autism is an area that newly has some research on it, and more is needed to understand this issue. So it's not just biomedical, but there's also research on social issues that affect people with autism as well.
Okay. I mean, that's great, and I would encourage anybody listening to this to go to the website and read. First of all, read your bio, because it's, your career has been, it's just really cool to read about somebody that's committed to this kind of research, and is, you're seeing the fruits of your labor, and it definitely is helping people. The second thing is just check out these resources that we've been talking about, because they are written very well, and it just gives out so much great information. I guess just to close up the podcast. Do you have any closing thoughts that you share with folks? Anything we didn't cover that you'd like to get out there?
Well, with the committee, we welcome members of the public to be involved. You can be involved by writing letters to the IACC, or you don't have to write old snail mail letters. We do have a spot on our website to submit public comments, or you can write an email to our email address, which is on the website as well.
Okay. And
the committee does receive these comments at every committee meeting, so we have 3 to 4 full committee meetings per year. Mm-hmm. Plus, we have an upcoming workshop that is on September 27th. Anyone in the public who's interested in our topic addressing the health needs of people on the autism spectrum is welcome to attend in person or watch this by video cast. And we always put out our live webcast of our meetings, and so we have a meeting coming up of the full committee in October, January, and April that are planned for the coming
so they can
year.
They can attend in person or by video?
Yes, you can attend in person or by video. We welcome oral comments. You have to register in advance for those, but we welcome those, and then the written comments. So if you have concerns, things that you are experiencing that you want to hear about from the committee or you want to see addressed, you're welcome to write those in. And the committee, although they don't have the opportunity necessarily to respond to each and every comment individually, this information comes into the committee and they're able to take it into consideration as they come up with their recommendations that they make to the Secretary of Health and Human Services and to different federal agencies about what needs to be done to improve the lives of people with autism. And
those meetings, are they here in this building we are, or are they?
They are here in either Rockville or Bethesda, Maryland. We usually have them in this area, occasionally in downtown DC.
Okay. That's great, because I mean I can sort of, as we've gone through this podcast, I can sort of see you as being like sort of like a liaison between the public and Congress. I mean, that's sort of the way seems like that's the way you guys are set up.
So yes, so we're a liaison between the public and federal agencies, and then we also do communicate with Congress, and so we really welcome that contact and hearing from people about what's most important to them, because we are doing our best to ensure that these voices are heard and that the field keeps changing, and we want to ensure the best quality of life for people on the autism spectrum and their families.
Good stuff. Well, thank you. We are here with Dr. Susan Daniels. I would encourage you, again, check out the website. She is the director of the Office of Autism Research Coordination. As you can tell, she's very up to date on what she's doing. So thanks for being here, and we appreciate it.
Thank you. I appreciate it.